I'm going to review pelvic anatomy in the female using this MRI as an example. We'll start with the sagittal plane. This is a T2 weighted image. I'll start off to one side laterally and head medially towards the midline. So this is a very good midline image right here. You can see posteriorly the sacrum of the spine. Anteriorly you see abdominal wall muscles. This is the pubic symphysis right here, where the pelvic bones anteriorly meet. And then heading from anterior to posterior in this sagittal midline plane, you see the urinary bladder. It's filled with fluid. Remember, fluid is bright on T2 weighted images. Inferior to the bladder, the base of the bladder is the urethra coming inferiorly. Then posterior to the bladder and the urethra is the vagina. This vagina has vaginal gel that's been placed into it. The purpose of this exam was to evaluate a cervical cancer, and the gel helps to delineate the extent of the cancer. That's very helpful for staging. Posterior to the vagina then is the rectum superiorly, and then inferior to that, the anal canal. So again, here we're seeing sagittal imaging. That's T2 weighted. So here's an adjacent slice again, detailing the anatomy. Now superior to the vagina is the cervix. So here you can see cervix. And then superior to that is the uterus. Now the uterus has multiple layers to it. It's got a muscular layer that actually has two parts. This is called a myometrium. The outer part of the myometrium tends to be T2 bright relative to the inner part of the myometrium. That inner part is also referred to as the junctional zone. So I'm outlining it here with the cursor. And then the very center of the uterus has the endometrial canal. So this is not muscle, but this is rather a glandular portion of the uterus. So again, this is a sagittal image. And notice here, this is very clean image with no significant motion artifacts. This is because it's a single shot fast spin echo technique in which each image is obtained in under a second. For comparison, this is a sagittal T2 weighted image that's acquired with a fast spin echo technique, but not single shot fast spin echo. So overall, this set of slices takes about 3 to 5 minutes to acquire, and you'll notice that when there's inconsistencies in where tissues are over the time in which the data is acquired, you get these ghosts. So you can see these little vertical lines here. These are referred to as motion ghosts. You can even see a ghost here that's curved that's representing the anterior wall of the vagina. One of the advantages, though, of this technique is that it is higher resolution than the single shot technique. So now we're going to move to an axial plane, and this axial plane is also T2 weighted. You can see here the bright fluid in the spinal canal. That's a tip-off that's T2 weighted. However, the fat is very dark. So notice here the fat in the posterior portion of the patient, or anteriorly in the interabdominal wall, is dark. So this is a fat suppressed T2 weighted image. One of the advantages of this is that you have now a greater dynamic range of the tissues that you're interested in. As we head inferiorly, we will now come to where the uterus is. So here, this first image that contained the uterus. Head more inferiorly, now we see again the uterus. We see the junctional zone. The center portion again is that endometrial canal. And as we continue to head inferiorly, now we get in a very dark portion. This is the cervix. Within the cervix, so you see the cervix out as this dark rim, but within it we see the tumor that has intermediate T2 signal intensity. So this is a cervical cancer. So we head more inferiorly. Now we come to the urinary bladder anterior, the apex of the vagina here, the cervix, you see a little portion of it still anteriorly, and then posterior to the vagina again is the rectum. So we continue to head inferiorly. Now we're coming to the urethra. So remember, the urethra comes off the base of the urinary bladder and then travels inferiorly, and in the female comes right to empty into the introitus. Now anteriorly here you will see the corpora, and these come together to form the clitoris. Posteriorly you see Bartholin gland. So here's Bartholin gland. And then just inferiorly again we come to the introitus. So this is an axial T2 image with fat suppression. Just for reference here, I'll also show again a high resolution T2 weighted image. This is an axial oblique plane, no fat suppression, so notice the fat is quite bright. Here the SNR is quite high, and this is done with a fast Beneco technique, not single shot fast Beneco, because remember the SNR increases as you increase the scan time. So here again we can see now that as we head inferiorly, we have vaginal apex here. As I head superior, the cervical tumor is right here. Then we're coming up into the uterus. Now this is an oblique plane. We oblique it relative to the cervix, and that's very helpful for judging whether the tumor is extended beyond the confines of the cervix, as that critically determines whether somebody's a surgical candidate or instead they would head for chemotherapy and radiation. Just for completeness sake, I'd like to show a diffusion weighted image here. So this is a diffusion image, but in this particular case it's done with no diffusion weighting. So here you see that the bladder is bright, the vaginal gel is bright, and then as we come superiorly into the cervix, the tumor is here. It looks like it's of intermediate signal. I'm just going to scroll through these low diffusion weighted images and go to the more heavily diffusion weighted images here. So now you can see as we go through this, now the urine is dark, the vaginal gel became darker, but the tumor really stands out. So it's helpful for detecting these tumors that have restricted diffusion because they're quite cellular. Now I'm going to move on to an axial image. This is T1 weighted, fat suppressed. It's done well after contrast has been administered, intravenous contrast, and therefore you can see a lot of the contrast collected in the urinary bladder where it has shortened the T1 and therefore become quite bright here. What's very interesting here is that you can see the tumor has lost its contrast enhancement. It's washed out, and so it's very clear where exactly the boundaries of that tumor is. And notice here it has not actually gone beyond the confines of the cervix. So this is a low stage tumor, and this MRI has been very helpful for determining that. But just to again recap the anatomy, heading from inferior to superior. So again, urethra, vagina, rectum posteriorly as we head superiorly. Now notice again urethra, vagina, which often has an H-shaped, rectum superiorly, come to the vaginal apex as we keep heading superiorly. And this vaginal apex then ends in the cervix. Coming up from the cervix, we have the uterus, then have the endometrial canal. In this case, notice it's T1 dark, whereas on T2 weighted imaging, it was quite bright. Coming off of the uterus is the broad ligament. This broad ligament then goes towards an ovary. So here you can see this very small ovary, in this case, on the left side of the patient. So that's a left ovary. Notice also what's right next to it, this very small bright structure. This is a ureter, so we'll follow this down. And notice that the ureter comes very close to the cervix here before it enters into the bladder. So we'll follow it inferiorly, and now we can see it's entering into the posterior portion of the bladder. This portion of the bladder is referred to as the trigone. Often you will see with higher stage cervical cancers, the tumor will grow and envelop or encase the ureter, and then this will obstruct the kidney and its collecting system will be dilated. That automatically is a higher stage tumor. So here I've shown you in this particular example multiple types of image contrast, T2 weighted images, post-contrast T1 weighted, showed you diffusion images, and just for completeness again I should show you this is an ADC map. This was calculated off of the combining the two diffusion weighted images, the ones with a little diffusion and with more diffusion, and notice here you see the tumor again stands out very clearly. This was the urinary bladder anterior to this. The resolution of these images are not very high, but the contrast of them turns out to be extremely helpful. So in a nutshell, I've shown a summary of female genital anatomy.